Brower, Benita Terry, and Laura McGee in case there are questions regarding the budget.
Great.
So with that, I think we're ready to get moving with senior services.
Okay, before that, I just wanted to give you my time. I want to reiterate what we've been saying all along. We appreciate staff on the CO side as well as our side. Mark and his team has been doing a bang up, beautiful job for us, and we appreciate you. They're so thorough, and we get our packets ahead of time so we can study it. And so if the public doesn't see all the intricate details that go into it, but we get emails at least the day before, a couple days before each of our meetings, so we can study our budget that we're going to be talking about today, the day before, and so we can come prepared. So I appreciate that. I think we have one last item that we have to do in probably the minutes, Madam Clerk, and then we'll go into presentations.
Item C, approval of the minutes from the August 11, 2022 meeting.
So moved.
It's been moved and supported. Any corrections? All in favor, say aye.
Aye.
Anyone opposed? Motion carries. Go ahead, Mark. Invite our first presenters.
Our first group is senior services, and I welcome them to join us. Welcome back, Kamal.
My name is Joan Savrakis. I'm Division Director, Wayne County Senior Services, here to present the departmental budget to Wayne County Commission. I believe Janelle Allen, Chief Operating Officer for Wayne County, is with us via Zoom, and I would like to have an opportunity to let Janelle say a few words.
Good morning and thank you. And first, my apologies for not being able to be there in person. I'm having some mobility issues. I have a broken foot right now, so I appreciate the opportunity to participate virtually. I would like to begin also just by briefly mentioning an update on what we're doing to fill the current vacancy at the department director level. As we all know, that our last director, Lisa Whitmore Davis, she left in June. And so we are actively recruiting. We have actually received a couple of candidates who referred to us, which we are considering, but we are also doing a public posting. So to ensure that we really are casting the net wide, to make sure that we are getting a strong leader to take us forward as we continue to operate the Meals on Wheels program and hopefully even eventually expand to other wraparound services. Joan just says she will be available to answer specific questions. Also wanted to say, though, with regard to our Meals on Wheels program, as we look forward to starting a new fiscal year with a new contract with a grant from the TSA, the Senior Alliance, we are two things I want to mention. COVID taught us a lot, as you may know, that with us serving one of the most vulnerable populations in the county during COVID, we had to close our congregate sites, which is a critical part of our Meals on Wheels program. While it clearly provides critical nutrition, it also provides just human interaction and networking and socializing. And because, as we all know, we had to minimize socializing during COVID, that really did have a real strong negative impact on the program. It also had made us move to a frozen meal component as well as to a hot meals component. So I want to emphasize and stress that in the department, we are absolutely one of our highest priorities is to resume hot meals to the maximum extent possible. And we've already been able to start that and resume that for 2 days a week, even in our current fiscal year. Again, we will be looking to expand that as much as possible, but of course we must be cautious because COVID is still well embedded in our communities. And so we still have to make sure that we have certain safety protocols for COVID as we do continue to expand our congregate settings. Another component is, you may imagine, you know that we use a wide network of volunteers to run our program. And once again, our volunteer base was severely impacted through COVID. And we are still having some difficulties with resuming. We do have a lot of dedicated volunteers, but most of our volunteers are also eligible for the service. So also we're very impacted by COVID. One thing that we are exploring during this fiscal year is using, at least for a certain area, a paid driver model. Again, we are expecting to maybe start a pilot during the next fiscal year, but that's one component we want to bring to your attention as well. With that, I'll turn it over to Joan, or if members have questions for us. Thank you.
Thank you, Janelle. Bless you. I'm available to entertain and answer any questions the commission may have.
Mr. Baker McCormick.
Thank you, Madam Chair, and good morning to you. The question I had, since we just had the director depart, do you usually do an exit interview or survey of any kind?
Yes, this is Janelle. Yes, actually, our Personnel Human Resources Director does conduct exit interviews, especially of our leaders. And so Donna Wilson, I do believe, conducted one with Lisa Whitmore Davis.
And from that information, do you make adjustments or look at the salary or whatever issues that may have been the reasoning behind someone leaving? Do we look at making adjustments?
Absolutely, if there's something within our control. As you know, sometimes, a number of times, people do leave, at least in part for personal reasons. But if it's something that really pertains directly to the job, we absolutely do take that into consideration as we recruit to fill the position.
Thank you.
Thank you, Madam Chair. I have a question on the Halal Meals Program. Have you seen an increase in the number of participants over the last 2 years, especially with COVID? And are we still using Country Chicken on Schaefer and Dearborn as the contract with?
Thank you, Commissioner. Yes, to respond to that, we did experience an increase in participants for the Halal Meal Program early in the pandemic. And also because we were allocated additional funding from the Senior Alliance, we were actually providing 2 meals a day to the participants in the Halal Meal Program. Recently, the numbers have pretty much stabilized. So currently we are providing meals to approximately 85 Halal Meal clients. And Country Chicken is the vendor. We secured a contract last year for 3 years with 1 2-year option to renew. So Country Chicken is providing those services, and he provides hot meals delivered on Mondays and Thursdays currently for those participants.
You happy with the service of Country Chicken? I mean, I know they're good people, but I'm just curious. There's no issues, no hiccups or anything, right?
No, they have been a very reliable, dependable vendor. And I think the community relationship that he has developed with this program and the clients has really been beneficial to the clients.
Do we have more people interested in signing up on this program? Do we have like a waiting list or?
We do not have a waiting list for service in any of our programs.
Thank you.
Thank you.
That is awesome to hear. Commissioner Martha G. Scott.
Thank you, Madam Chair. Good morning, Joan. Good morning,
morning.
Karub. Welcome back. And it's good to see you even on Zoom, Janelle. So thank you all so much. And thank you for the work that you're doing. Now, it said one vacancy. Would that be the director?
That's correct, Commissioner.
Okay,
Yes,
all
the
right.
department director.
The department director, right? Okay. All right. I don't think I have any questions. I just want to thank you and thank the volunteers for all that you've done through this COVID. And like was said, it's not over yet. So we still have to, but we've learned some things. So we'll be able to manage it. So again, thank you so much for what you guys are doing. Thank you. Appreciate you. Thank you, Madam Chair.
You, Commissioner Anderson.
Thank you, Madam Chair. Joan and all of your folks that work with you, I'd like to express my appreciation for the good job you guys do. And it's been beneficial, especially beneficial to folks in this tough time we've had the last couple of years. Just wondered, I was looking and I didn't see it in the notes here, the number of meals delivered, including halal, for 21-22 and the anticipated for 22-23.
I can give you a daily count. We are providing approximately 2,300 meals a day. So that breaks down to, again, including the halal, the liquid, home delivered, and congregate meal program. The numbers have been pretty steady. There has not been a significant increase in any of the programs. So we are able to provide consistent service to all of those who are requesting and are eligible to receive the service.
So roughly 2,300 a day. Now that's for how many days a week? 5 days?
5 days.
Do all of the recipients participate with all three or all 5 days? And because aren't you doing some delivery 2 days a week and doing the other 3 and a dropped off in a frozen?
Correct, which still constitutes 5 meals for the week.
Right.
So Mondays and Tuesdays, we are providing congregate meals to eligible seniors coming to the sites to participate in the congregate program. And then on Thursdays, we deliver a 3-pack frozen meal to congregate clients as well. They can come and pick them up, and we deliver those to the homebound for Wednesday, Thursday, Friday meals. So all clients are receiving 5 meals per week.
Are you still finding difficulty in getting volunteers to do deliveries?
That has been a challenge. We continuously are seeking to recruit, and I know that we have shared the need for that with our Wayne County commissioners as well. And we appreciate whatever outreach you have been able to include the volunteer need in your newsletters or your correspondence. So certain communities struggle a little bit more than others, but we are continuously seeking a volunteer recruitment.
I know that's been a problem, and but I think or at least hopefully you're seeing it build back up slowly. And if you could, someone in your department or yourself could provide us something that would be something we could post asking for those volunteers. I think you did it one time. And then we can hopefully put it in our newsletters, our e-newsletters, and get the word out for folks that might be looking for something to get back into that or recruit new people. But it
We will provide you with something to include. That would be great.
Okay. All right. Thank you.
Thank you.
Thanks for what you're doing. Thank
You. Any other commissioners? Commissioner Baker McCormick?
Thank you, Madam Chair. Are there any other programs that we should be aware of that you provide seniors in Wayne County? We do an excellent job on the food service and distribution, but are there any other?
Our other
Programs.
services provided for seniors in Wayne County, the Senior Alliance, who is the area agency on aging, where we receive our funding from, they provide a variety of services, Medicaid, Medicare assistance, in-home services. So they are very instrumental in providing services, as well as the DAAA, Detroit Area Agency on Aging, provide direct services for seniors in the service area they service. You're welcome.
I suggest the websites on those organizations because they do have a lot of services that our constituents can utilize. And they are doing a very good job. Any other commissioners have any questions on this particular budget? Mark Abbo.
Yeah, thank you, Madam Chair. I just want to offer my kudos as well to the leadership and staff of seniors. They've effectively got a status quo budget. It's increasing by only 2%. And I note that salaries are increasing by 7%, which I think is a good thing. So congratulations on a job well done.
Thank you.
You. I think we're done with this presentation, and Abbo, please invite the next presenters. And Human Services. Good morning. You may begin.
Good morning. My name is Melita Jordan, and I am the Director for the Department of Health, Human and Veteran Services. Thank you very much for inviting me to be here. Although I know this is mandatory, I still appreciate being able to come before this esteemed group. I also want to say that in doing so, I am here as your public servant to answer as humbly as I know how your questions this morning, as well as to present a presentation. But certainly willing to start off with your questions if you'd like, but I did bring a presentation I think that I sent in advance.
I would like you to just go ahead and make your presentation, and that will, I'm sure, bring some more questions afterwards.
We have the PowerPoint. Thank you. I also just want to acknowledge my staff that is here as well. So my division directors are here, as well as some of my managers. And again, I appreciate them, the support. Also, my chief operating officer, my boss, Ms. Janelle Allen, again, is available here on the Zoom. So again, appreciate being able to come this morning to present before you. So this is my second opportunity. If I remember, it's been 15 months that I've been here now. My first opportunity was 3 months into me arriving. And so each time I come before this group, always a little nervous for a director to come before this esteemed group, but I appreciate it. So this time I'm a little bit more nervous because I've been here now 15 months. So now you get an opportunity to really scrutinize some of the work under my leadership. But again, as I always say, I'm just a talking head. I have wonderful staff that do the work, and they have done a tremendous job over these last year. A number of them are new. However, they have come and parachuted right into their positions. And I am very grateful and thankful for the work in which they do in serving all of the residents here in Wayne County. So I'm going to start off with public health. And recognizing in our public health, we do a tremendous amount of work. And as you can imagine with the pandemic, and although we're in a post-recovery phase of pandemic, the staff and the leadership have performed enormously in terms of one, providing not only the services, but also the number of vaccinations. Just a week ago at the HHS committee, Dr. Avni Seth provided a presentation around our vaccination rates from 6 months up until individuals that are above 75. So in Wayne County, 12 years old and above, we are at 72.7%, which is 64.6% in the state of Michigan. So we are exceeding the state in terms of vaccinations for our primary series. For our 5 years old and above, 68.7%. Again, the state is 61.2%, once again exceeding the primary vaccination rates. And for our 6 months, which has most recently been implemented, again, we are at 64.4% and the state is at 57.8%. So once again, we are exceeding the rates of getting our primary series individuals vaccinated. And so we're very proud of the work that's being done. Again, we still have surges, of course, of the virus, but we are continuing to provide on a daily basis, not only vaccinations, but also boosters. And we are continuing to provide support to all of you at your community meetings, at your events that you're holding. We are there to support you with vaccinations on site, as well as at our office and throughout the Wayne County area to make sure that we can reach as many people as possible. I also want to share in terms of some of the other work in the community, particularly around our lead program. Again, in coordination with the Michigan Department of Health, Human Services, and EGLE, we've responded to not only exceedance in lead, but also have worked with a number of you in your communities in terms of making sure that your residents receive water filters. As a matter of fact, we provided well over 10,000 water filters in the community, in addition to those individuals and homes that have been impacted by a lead exceedance. We have been there to respond to their concerns. In addition, we provide education, coordination, as well as providing blood levels, checking our children, as well as our adults as well. We recognize that those individuals who also live in the rural parts can certainly bring lead dust and so forth into the home. So we're trying to make sure that we provide all of the education that's necessary to reduce the exposure of lead within the home. In addition to some of our accomplishments that I'd like to mention, of course, is our web-based COVID dashboard. That is something that we've worked very closely with the Department of the OIT and technology in terms of making sure that you have a dashboard that provides you with information in terms of not only cases, but specifically within your community. So it is by zip code, and in addition to providing it in terms of the jurisdiction that you're in. So we encourage you to visit the dashboard. You can get information there, as well as specifically in terms of what's going on within your own communities. I want to just move on to health services within our juvenile detention facility. This slide here, in terms of, I'm sorry, let me just go back for a second. I just skipped over some of our priorities. And so again, as you can see, in terms of the, as we move forward, certainly are trying to make sure that we address our opiate issue that we have here in the county. So with the new funding that we have, we are developing a strategic plan so that we can move forward in terms of prevention, providing, and we'll be working again with the communities, but more importantly, providing services for those families, as well as those individuals that may be impacted with an opiate substance abuse. Along with working with law enforcement, we will be developing an advisory board to work with us as well in terms of recommendations and individuals who have expertise. We are fortunate in the county that Dr. Avni Seth is board certified in opiate addiction and actually provides that education services as well as assisting in providing, most recently, being tapped also by the leadership groups that is working with the opioid addiction in the medical society as well to provide her level of expertise. So we're very fortunate to have someone with that type of background. Also, we are responding with epidemiology surveillance. Again, you can imagine in public health, it is through our epidemiology data surveillance that we're able to make our decisions based on data that we achieve. And so one of the things we will be looking at is trying to make sure that we do a broad-based data analysis, not only in terms of hotspots here in the county, but more importantly is to be able to gather the different types of data that's necessary for us to be able to make decisions around public health. Data is needed for all areas across the board in this particular division. So we are gathering not only the expertise of external individuals, and I think I spoke about this when we talked about our partnership with Wayne State. One of the things that we will be doing is working very closely with them so that we can tap into those resources at the academic level so that we can provide epidemiologists to shed light on some of the areas that we have not been able to really look at in such a way to give us the kind of information that not only are you asking for, but the residents in the county need to have to understand some of the challenges in terms of the disease processes and illnesses, and then move us from an illness mode to a preventive mode so that we can better serve our residents here in the county. So moving on to our health services within the juvenile detention facility. This slide here, as we move forward, just shows us in terms of some of the healthcare services that are being provided in our juvenile detention facility. A number of our young people, when they come in, perhaps have not had a dental exam or seen a dentist, so we're able to provide dental services. We're able to do complete physical examinations as well as get our young people with their immunizations, and that may be for chickenpox, that may be for measles, whooping cough, and a number of the other, as well as COVID. And so we are making sure that not only those that may have even tested positive, we also are providing them with the appropriate vaccinations and treatment as needed. Again, as we move forward in terms of the number of the priorities also is in terms of making sure that we can continue to provide educational services. Again, we presented before the HHS committee previously in terms of the schools, in terms of the education packets and how the young people can still get their, during a school year, their education in terms of their schooling, in terms of the various subjects like English and math, history, and other, depending on the level of grade that they're in terms of how they get their education. So we will be moving forward with that as well. All right. Moving right along, the areas also of our juvenile and youth services priorities as we continue to look at some of the youth services. We've covered well over, I'm change what I was going to say. What I was about to say is that in terms of our youth services at the Juvenile Detention Center, I also just want to mention the fact that because of a number of closures that we've had across the state, we are seeing a longer length of time that our youth are actually at JDF. As you know, the facility was set up for pretty much no more 30 to 45 days that we would have our youth in the facility. However, we have noticed that we are seeing our youth remain anywhere from 210 days to 200 and perhaps 30 days. And so that is due to the fact that there are a number of closures across the state that we just don't have the placement, the bed placement for our youth. And that is something that, again, we have been working, not only this administration, but we have been to Lansing to have conversations with leadership regarding how can we move forward. We are also looking at the potential of how do we provide more services in terms of being able to perhaps look at a long-term facility for JDF, because we are keeping individuals there longer. We need to be able to provide some wraparound services as well, so that we don't have our young people not receiving the critical care in which they need. Not only is it healthcare, but also the behavioral health services, in addition to the recreational services that every child needs to be having the appropriate physical activity, but more importantly, to be able to be in an environment that would help maximize their potential. And so, although individuals may be there, we need to make sure that we're doing all that we can do as a society to make sure that we are able to provide them not only with the education, but also the resources. And so that is where I clearly see that we need not only the support of the administration, but we also need the support of you as well. As we continue to look at mentoring programs in terms of also trying to make sure that we increase the personnel that we have there. One of the questions that was asked of me on your area was, what has been some of the challenges? Well, the challenge definitely is around staffing. And as you know, across the country, we have had a tremendous amount of decrease in staffing in various positions. But more importantly, we certainly have had decreased staffing in certain medical conditions and medical specialties. Not only do we have a decrease in nurses across this country, not only due to the lack of more nurses coming into the profession, but because a number of nurses actually lost their lives during COVID. A number of ancillary personnel also have been impacted by that. So it is important that we're able to not only increase, but also find other venues that we can really put into place in terms of trying to increase the workforce. So I will say most recently, working with Wayne State again in terms of writing a grant that would help us apply for a tremendous amount of funding from the CDC to increase our workforce. And that's going to be very important. If we're successful, we should hear in November if we are being awarded that grant. But I will tell you, it is the partnerships and relationships that we're going to be able to build a workforce that will be sustainable over a long period of time. Just going to quickly move to speak just briefly around access to care. As many of you know, we have the Health Choice Program. We've been very successful in helping businesses as well to expand upon the number of people that they enroll. This body has also been instrumental in helping the Health Choice Program move forward in terms of supporting it. And so we are continuing to work with our partners in Health Choice to expand and keep businesses functioning and operational here in Wayne County, because we certainly need to make sure that we can continue to have people employed. And so again, we have been very happy and fortunate to have that type of support. The Veterans Administration, again, we are very happy and proud with the work that we are continuing to do to support our veterans. Moving forward, we have not only new leadership, so most recently, Mr. Randy Walker joined us, who is also, many of you met previously here within this chamber, is, I always make sure I get it right, Air Force. Thank you. In the Air Force. And so Randy has jumped right in. And one of the things I will say just immediately upon coming on board, we do have, was able to move right along and shepherding one of our grant opportunities through. And so we are working to make sure that we can accomplish that as well. That is something I know Commissioner McCormick Baker has approached me about, and so we're working to move that forward as well. And then just quickly, I'm just going to mention that we have just a week ago, I met here, of course, with the Auditor General around the MEO's office. And so again, I just want to bring to your attention just briefly one of the major accomplishments there as well, that we were able to get our website up and running. So it is on the website for our unclaimed and unidentified database for bodies to help the public help search that database. Also, a year ago, like I said, 12 weeks into being here, came before this body also to talk about the fact that we needed 2 cars. And so I am pleased to let you know that we were able to purchase those cars. We thank you for the support. And so now that we do have 2 new cars that will help us do the transports that we need to do and to go to the sites with the investigators to be able to do their work. So we're certainly pleased to let you know that we were able to accomplish that as well. So I'm going to stop there because I know that you do have questions, but I just wanted to quickly go through a few things that you could see from the slide presentation that we have been doing and accomplishing during this period of time. And there's, of course, much, much more, but because of brevity, I will stop and allow you to ask me questions.
Thank you. Didn't look like you were very nervous. You did very well. I wanted to break in and say, you're doing well. Don't be nervous. Thank you for that. We do have questions. Commissioner Baydoun, Commissioner Anderson, Commissioner Kinlock.
Thank you, Madam Chair.
Correctly, all of us.
Thank you, Mrs. Jordan, for the presentation. And I want to publicly thank you for your leadership. I have personally reached out to you several times on issues where you had stepped in and resolved them. And I want to thank you. And I would be remiss if I didn't also say a special thank you to Janelle Allen. Her leadership during the pandemic was exceptional. She appeared on my town hall meetings that I held several times to inform the residents about how we stay safe during the pandemic, and she was amazing. Thank you, Janelle. Several things I would like to talk about. Obviously, we're still in a pandemic. You mentioned the vaccine rate in Wayne County is increasing. Can you tell me what's the percentage of the vaccine rate in Wayne County versus what we have on the state level, like statewide? We're more than 70%, I believe. Am I correct?
Yes, you are correct. However, the numbers are changing somewhat because, again, if you recall, I mentioned the fact that we are now including our 6-month-olds and older. So it made the numbers drop slightly. However, that is for the primary doses. But I will tell you that we are still exceeding the state levels as we are getting individuals, not only primary vaccinations, but also those individuals who are getting their boosters as well. So we are certainly doing well, and we report this information on a weekly basis on Monday mornings, and on Tuesday mornings, we also report to the 42 communities as well in terms of the most recent data.
Yeah, I was sharing the daily numbers every day, but then people got sick and bored. I stopped sharing them. Some people are still asking for them. Are you seeing a decline in the mortality rate because of the boosters and the 3rd and 4th vaccines? Are we seeing a decline in the mortality rate?
Absolutely. There certainly is a decrease in the number of deaths that we're having. And that is, again, due to the fact that individuals are getting vaccinated. The data that came out from CDC on a national level is showing that those individuals who have received 1 and or 2 booster doses have less chance of dying than those that who do not receive or get their vaccinations at all. So we do know that if you are vaccinated, that you have less chance of dying if you are exposed, even if you were exposed to the virus.
And with the school year upon us at the end of August, people going to be more indoor as the weather starts getting cooler. Is your department prepared to handle any emergencies, any unforeseen situations, if you will? I hope and I pray that we're not going to have Zoom meetings for children, online learning. But do you see any issues that could be coming up, or is your department prepared to deal with any, related COVID situations?
I think that we are very prepared in terms of looking and forecasting what we believe. Again, this particular year, the CDC is releasing, or the FDA will be releasing, a new vaccine that will be specific, again, for the Omicron variant. But we also know that the variant continues to reproduce. And so therefore, we have to be mindful of that. But I would say that, yes, we are prepared to handle the upcoming school year. I can't tell you at this point what our specific plans are as it relates to that, because it does depend on some of the data that I don't have at this moment in terms of an anticipation of a flu virus coming as well. We anticipated that last year, but it did not happen as difficult or hard as we thought it would come. But we are prepared in terms of handling the capacity and being able to get the appropriate vaccines from the state that will come in from the federal government that will come here to Wayne County. In terms of having the capacity of staff, yes, we are prepared to make sure that, as we have been doing for quite some time, but definitely during the pandemic, we do and are in the schools providing vaccinations on site. And so my staff is well prepared to do that, and we will be able to continue to do that, as well as in the community, so that individuals can get vaccinated within their own communities also.
Again, Mrs. Jordan, thank you, and thank you to all your staff. Thank you, Janelle Allen, for all you have done, and keep up the good work. Thank you.
Thank you very much.
Thank you. Commissioner Anderson.
Thank you, Madam Chair, and welcome, Ms. Jordan. I just wanted to, first of all, do the same as my colleague did. I wanted to thank you for your professionalism that you've brought to this position, and your incredibly responsiveness to when we reach out to contact with you about several things, and your immediate attention and getting back to me was very impressive, very impressive. I wanted to tell you thank you. I did want to ask a couple of questions. Media reports around the country, and particularly in New York City, are showing outbreaks of polio, resurgence of polio. And are we seeing any of that in Wayne County at this time?
We have not received any reports of polio in Wayne County at this time. We will keep our eye open for that. So again, we are alerted. And as you well know, it's been a long time. We eradicated polio many years ago. And yet we have found that New York is being faced with that. And so they do believe it was, again, transmitted from out of the country into the United States, but it is being evaluated, and they're looking at it very closely and trying to make sure that, again, individuals can be treated so that we can stop the spread of polio. But that is something that is quite alarming in terms of the fact that the country had come very far over the years of eradicating that. And now we're finding ourselves back into a situation. And that happened, as you all know, also with tuberculosis. We had, again, almost eradicated tuberculosis. And now, once again, we're seeing ourselves getting an increase in that as well. So it is important as we continue to build up our public health surveillance. We're able to address those things. And that goes back to the epidemiologist that I talked about. Having epidemiology information and surveillance and being able to anticipate and being prepared. And so the goal, one of our major priorities, is to make sure that we have the resources and also that we're able to prepare the public and provide the information and to educate the public in terms of what things that we've done in the past can come back again if we are not vigilant in terms of making sure that we are following public health protocol. So But if we learn of anything, we certainly will provide information to this body. But in addition, we will provide information to the public. But we are clearly aware of some of the diseases that we've had in the past that we don't have, that is now present again today.
Are we ready for, if we start seeing cases of that, do we have vaccination material or fluids to combat the resurgence of polio here?
Well, I am not at this point have prepared for having vaccines available, but I will say to you that we will be reaching out to the state to have conversations in anticipation to say what happens when we first learn that, say, if Wayne County and or the state of Michigan gets a polio case, what do we do? So I most recently reached out to the Michigan Department of Health Human Services over the weekend about another matter, but I am in contact with them. And so as you know, they're just a phone call away. And so we certainly can make sure that we get prepared. But again, I don't have vaccines available for that at this moment because we have not been alerted that we have any indication that there is a problem currently that's coming.
Is there still a good partnership with, say, some of the hospital systems working in our school districts and some of our schools and providing those vaccinations and other needs that children have that are in school that may not have access to it? I touched on it earlier about what we're doing as the county is doing, reaching out and providing services, dental services and other things like that. But I know some of the school districts have a partnership. Do we monitor those to see where that hole might be that we need to fill? I'm assuming you do.
Absolutely. So we have a very good relationship again with our health systems. And again, under Dr. Seth's leadership, she's been able to establish relationships too with our other health officers, but more importantly, with our CEOs as well as COOs and managers at hospitals so that we're working very closely with them. And so we've developed partnerships. That was one of the areas I would say that we were not as strong and robust in, but we have certainly expanded our relationships with health systems. I meet with them also in terms of discussing how we can partner closer, because again, we can't do all this work alone. We definitely need partners to help us build an infrastructure here in Wayne County. And so that is what we're attempting to do, is work more closely with individuals and leverage resources. Again, sometimes the health systems have more resources than I have. And so we want to make sure that we're leveraging those resources so that we are in a partnership and that we can work together, that we can respond very quickly to not only outbreaks, but those emergencies that come upon us that we are not anticipating. And so that they're able to provide and deploy resources that I sometimes may not have.
All right, thank you very much. That's all I have right now. Thank you.
Thank
you, Madam Chair.
Yes, good morning, Dr. Jordan.
You always want to call me doctor. I haven't gotten that. That degree just yet.
Apologize for that. No, but one thing that I wanted to talk with you about was the JDF and the staffing concerns and over there, and specifically the vacancies and how they are impacting its operations. We are aware of the recent incident that occurred there. That I know that is still being reviewed by Janelle Allen in your office and in getting to the bottom of that. But my question for you is, as relates to the current staffing levels that are there, the required overtime for the current staff who have to operate and run the facility, how does this budget create any sort of relief in addressing some of the problems that I'm hoping that are not going to become so problematic that they become systemic, but what areas in this budget have you included to address some of those staffing level issues? And also, the impact that it's having in the delivery of not just the safety concerns, but also the health needs of the detainees at the facility. I understand that there may be some behavioral health concerns as it relates to not the administration as it relates to medication. And I'm wondering if that's tied into staffing levels as well.
Let me sort of take your question apart a little bit. So first of all, just to let you know that we have had staffing recruitment that we've been doing. And because of some of the closures at other places, we have been able to interview and bring people on from the closures that we've had at some of the other institutions. Also, we are and have provided increase in salaries also for the staffing. But I will also tell you that when you have a lot of media attention that becomes negative, it is very difficult to recruit in an environment like that. So I will tell you that inciting fear and suggesting that it's an unsafe place to work does not help the county, it does not help the facility, and it does not help in trying to recruit individuals to come there. So I do think it's incumbent upon all of us, first of all, is to make sure that, again, yes, we do face a challenge, and I'm the first to say that. But I'm also first to say that we make sure that we keep employees safe as possible, as well as the residents that is under our care. That first of all is our responsibility, and we have responded immediately to any situations that have been unrest. But also trying to make sure that we not only educate, but also to train individuals so that they can work in a safe environment and provide the training that's needed. So I will say that the Human Resource Department, along with the leadership of Janelle Allen, myself and my division directors and others have really went out trying to make sure that we calm the waters and also provide facts versus inferences or misinformation that is circulated in the public that is simply untrue. And so our job is to make sure that we can continue to bring people into the environment and know that they have a safe place to work and offer them a decent salary, a wage that they also can live upon.
Thank you.
Thank you. I'd like to call on the Chair of Health and Human Services, Commissioner Baker McCormick.
Thank you, Madam Chair. I just want to commend you on the job that you're doing. You, like you said, only been here for 15 months and you jumped in and put out fires and you're responsive and you're doing a great job. So I just wanted to start by saying that. The JDF facilities and the conditions, is there, and I didn't see it in the budget items, are there any major upgrades to the facility that's needed to ensure that the staffing and our young people are living in a good, solid condition?
Sure, so let me address that. As you well know, that JDF is a very old building. You also know that we're moving into a very new and modern building very soon, and we're very pleased and proud of that. However, we have had some challenges, and a lot of the challenges oftentimes come from our young people throwing their clothes, towels, and food and things like that into the commodes, which again, you can imagine plumbing is a challenge here in Detroit, but it definitely is a challenge when you throw clothes and food. So we have had to manage some of that. We have had to call on our partners in Detroit to come over to help us to unclog some of the issues that have occurred there. Those things happen. Young people are going to be young people, but we also have old pipes. And so the pipes cannot tolerate stuffed clothing and things like that. So we've had to address those issues, and we certainly have had to have people to come out and help. But I will say to you that anytime you have an old house, like some of us may live in an old Victorian house or an old brick house, you know that if you don't do proper plumbing and so forth on a regular basis, you're going to have some challenges. And so I will say that we are correcting those problems. I can't thank Daryl and Mike, Al, enough for not only their quick service, but also their professionalism and making sure they respond immediately to the concerns. These men have worked day and night, making sure that they come over to unclog and to handle a number of these situations that we've been facing. So we appreciate the work that the building maintenance folks have done for us. But I will tell you that our young people have, did some destruction to the building. And we are, again, making sure that we can keep it still operational. And that's a challenge for the staff, and it's a challenge for the people that work there as well. But I will tell you that we are making do, and the kids are safe. That is our responsibility, to keep people health and safety wherever they may be. It is our responsibility to do that. And I will tell you that the staff have maintained doing that even during the roughest and most difficult times, that they have kept people safe.
So we have some really great youth diversion programs. And as we reopen our schools and kids go back to school, are we working with the municipalities or school boards to ensure that they know of the programs that we have, and especially as we deal with mental health related concerns of our youth? Do we have any plans to work directly with the school districts?
We work very closely with Rain Risa, and also we are developing some other programs, diversional programs and mentoring programs for our youth as well. And you may recall, again, early on in my career, or early on in my tenure here, let me say that, I did ask, and I think it's so important that we have mentors and individuals like yourselves, particularly a number of the males, to be able to come to JDF and be part of a speakers bureau and be able to share information. Because again, that's what they need to see, is role models. They need to see individuals that can speak to them, who also, or people that you can recommend, who perhaps were derailed early on in their career and then turn themselves around. And so I know a number of you know individuals like that. I would welcome you to recommend individuals and or yourselves to come over so that you can spend time and see, again, what these young people need to hear and see, and know that they can change their lives as well. You would be a great inspiration to them. And I welcome you to come over to be able to share your level of expertise and how you may have came up on the rough side of the mountain, that you can share that with these young people.
Well, again, I just want to thank you for all the work that you do. And of course, we can't leave Janelle Allen, the awesome Janelle Allen, out. So thank you so much, Janelle, for the work that you have done and continue to do.
It's been a pleasure to work under Janelle's leadership.
Thank you. Commissioner Marecki.
Thank you, Madam Chair, and thank you, Ms. Jordan and Janelle, for attending our meeting today and for such a comprehensive overview of what's going on. All of us that are on HHS know this, but it's a good reminder of things. And I also, excuse me, I also enjoyed reading your accomplishments and what you're looking to do in the future and the CEO's report. I just have a couple of questions. One of them goes back to what Commissioner Anderson was talking about. Is there any specific data to show that kids in Wayne County are behind in their childhood disease vaccinations, since the medical care was shut down during COVID pretty much?
Absolutely. And we can actually pull that data and get that to you. Again, we do have the data that comes from the state that actually breaks down for every county the number of individuals, how old they are in terms of where they get their, how many of them have gotten their vaccinations. That was one area that we actually looked at when we started the rollout for the COVID pandemic, was that you can know in advance the number of individuals, be it young or old, who have been vaccinated and or older people who have received their shingles vaccination by looking at that data. So that way you know where to start. So we began to write a strategic plan in terms of how we were going to move from the rollout that initially happened when you had the long lines and you had the drive-throughs, to a community-based way of approaching. You know where to go, not only by the SVI or your vulnerability index, but you could also tell by the number, by your zip codes and your census tracts, individuals who have been vaccinated. So that's how you can determine where you want to go first. That helps guide you in terms of what neighborhoods, what jurisdictions, and what communities you want to look at in order to make sure that you are targeting the right population. So that information exists, and we do look at that information so that when we are determining what would be the community that we're going to first look at, you look at the data first. You can look at your immunization data to determine that. So that's how we know where to start.
Okay, this is for all immunizations.
All immunizations.
Okay, because I know, I think parents too, if they miss the first couple, then they get confused on, are they going to double up when they go in to the doctor? So I think there's some confusion on that part for especially new parents.
Sure. Well, again, like I said, I'm dating myself now for a moment, but many years ago, again, the public health nurse, they had the little yellow book. So you went into the home and you may have done, or they come to your public health clinic, they got the yellow book and you would write it in there. And that yellow book is something that you held on to for a very long time in terms of knowing when you're supposed to get your measles vaccination, or when you're supposed to come back and get your TB, or when you're supposed to come back and get your whooping cough or whatever. So Bright Futures still put out a book, and Bright Futures is one of these immunizations. It's an organization that allows you to sort of gives you the information about when you should get your immunizations. And so again, most moms get that information when they go to their prenatal care, or when they get their prenatal book, baby's born, that nurse usually comes out. And now we use our community health workers to help do that same kind of work. So community health workers work right alongside of our public health nurses to do that work. But that is one way of making sure that people know, because you do sometimes forget. There's electronic books now that help do that. But again, I'm that old school where I need that little yellow book, to sort of hold on to. But yes, it does exist, and it helps parents know when to get their vaccination.
Yeah, because I think, I don't know how long it was where they couldn't even bring the kids in.
That's correct.
If they had
That's
newborn
correct.
kids, they weren't getting any vaccinations. So and one more question. I remember someone telling us about this, but if you could just refresh my memory.
Sure.
It looks like the MAT program was fully implemented in April of 2022 in the jails.
It was actually, it was April, yes, because they started, NAFCARE started October 1 of 2021. They had 6 months in order to initiate the MAT program.
Okay.
And so the MAT program has been initiated. And I want to say, if my memory serves me correctly, I think we have 200. Good. We have 200 individuals that's enrolled in the MAT program. My staff just shook their head to say that I got it right. Yes.
So when they come into the jail, they get this medication. I read what the medications were. And then when they are let out, they're followed closely.
That's
that
correct.
They don't go back into the opioids, or they just keep giving them the medication. How does it work?
So first of all, they assess when they come in. So we just don't hand them the medication when they come in. So there is an assessment that's done. And then when they are discharged from the jail, yes, we make sure that they are either connected, one, to our the Federal Qualified Health Center. So we have a MET program there as well. And or they are connected to our other programs that we have also working with behavioral health or DWIN. So we do have programs that are available so that they're followed. And we try to make sure that we keep up. So we do have what we call our community health workers who will reach out, follow up, and we make sure when they are discharged from the facility that they actually are given an appointment that's on the books that they then will be seeing within the first 2 weeks when they are released.
Okay, so do you have data on how many people drop out of the program? You have 200 enrolled now. Do you know
Yes,
how successful it's been?
Yes, we have information that will show you if individuals have not shown up or they've dropped out of the program and no longer are continuing to do it on a regular basis. And so that, again, that's that data collection that we're able to capture. So again, it's a new, it's fairly new. So we're just beginning to get that information. And so at some point, we'll be able to provide, again, at HHS, we'll provide you the status of where we are with the MAT program for the NAF Care program.
All right, thank you.
You're welcome.
Thanks, Madam Chair.
Thank you. Commissioner Martha Gustad.
Thank you, Madam Chair. Good morning.
Good morning.
Thank you for being here, and your department certainly entails a lot of issues. But one of that I've always been really concerned about was lead. Now, do you know if we're doing anything to work with the state to get some funding in for these older homes? I know in my district, I have a lot of older homes, and we have a lot of children that are still in these homes. So is there anything that I can look forward to?
Well, we always are certainly trying to address your area. And I do believe, if I remember correctly, again, when I first came on board, I know Carol Osterberry had spoke, and your area was one of the areas that they did use the grant funding to address a number of the homes in your area. So yes, we do have grant funding. We've had some challenges with that particular grant, but I'm trying to shake it loose. And so I do anticipate that we will be having some funds to provide lead services and lead repairs to the homes in some of the communities. I can't say specifically, Commissioner Scott, what the amount of that funding at this point, because I don't remember off the top of my head. But I will tell you that yes, there is a funding available, and we hope to be able to get that money out to the communities to be able to help.
Would that entail replacing the lead pipes in these homes?
If I remember correctly, it doesn't necessarily replace the pipes. I think there's some initial part of it where we do replace some parts, but that which goes out into the street or under the ground, that's an area that we don't replace. But I know that's part of the issue that probably need to be replaced, but that's a state issue. That's not something that comes down to my level where we have funding to correct that. So where we can help, we provide, I think, those pipes that go right into the house, but not necessarily those pipes that go deep under the ground. That becomes the state repair, not necessarily the grant funds that the county has to repair that.
What about the pipes in the homes?
I think it does do that. But again, I will have to refer to Dr. Seth and her staff to give me some more information about that. But as I said, there is the grant funds for that. I'm trying to shake it loose, though. It's sort of held up somewhere, and I'm trying to loosen it. But when I do, I'll let you know for sure.
Thank you. I appreciate that. Thanks.
Thank you. When you do get that information, we would all be very
Oh,
interested.
I will make
And
sure everybody has it. That's for sure.
it would be nice to know how much it is. We'll probably know anyways, how much it is and specific purposes and how to access it.
Absolutely. Will do.
We had a discussion on this in Homeland Security of all places.
Yes.
When we did their budget, so we're very interested in the lead-based.
Absolutely.
Commissioner Baydun.
Thank you, Madam Chair. Mrs. Jordan, I have one more question I forgot to ask you earlier. One of the important aspects of your operation, if you will, is the health inspectors that come out and inspect restaurants and food establishments. and the examiners that examine the plans when they submit to your department. Are you adequately staffed as far as that aspect of your operation? Are you short-staffed? Do you have enough inspectors that go out and inspect all these food establishments throughout Wayne County?
I believe that we do. I know that's been a challenge, and I know that there's a couple of questions that you've asked me about previously, and I've tried to be responsive to make sure that those individuals that contacted me, that they did receive their services. I do believe that we have many, many new businesses springing up. That is for sure, and that's a good thing for the
Yes.
county. But I also know that there are many challenges that oftentimes business owners don't understand in terms of opening up a new business that need to be inspected, particularly as it relates to food. And so I do think so, but it is a process, and the process can be sometimes slow. And that is because on both sides, sometimes it is because the person who's opening up a business doesn't understand the quote, the nuances of the inspection, and or they don't always meet the specifications that's needed, or they don't think that that's appropriate, whatever that requirement is. However it is, because it's so important that we make sure that everything is checked, double checked, and rechecked to make sure that one, a business has all of the appropriate plumbing and all of the appropriate appliances so that you don't have an unnecessary fire or an explosion or anything like that. That's critical. And I think that we have excellent staff who's been doing this work for a very long time. And sometimes it is because people don't always send in the proper information that's being requested. In some cases, yes, I have gotten complaints that my staff have been slow to respond, or they didn't respond, or nobody got back to them. I have addressed those issues in my office. My expectation is that my staff answer phone calls within a reasonable period of time. And when I call reasonable, I do think definitely within 48 hours that somebody should call somebody back. Now, they may not think that's reasonable, but I think that's reasonable. And so it is important that we get back to people because, again, we are a customer service. And so therefore, we must serve our customers. And I think that they do an excellent job. And where you have challenges, many of you have reached out to me and I've tried to address those challenges. Again, oftentimes I get the business owner's perspective and then I get my staff's perspective. And my job is to make sure that I look at it objectively and try to make sure that I satisfy everyone in terms of getting what they need. And I believe as best I can that I've been successful in making sure that that happens. But no, do I think I have limited staff? I think that I have the appropriate staff to do the work that's currently being done. And I believe in my presentation, it does show that they've done more than, I have to put my glasses back on because I can't see without them. But I do believe that we've done a significant number of inspections. If I can just find that very quickly. My staff brought that to my attention. I'll get that number for you, Commissioner Baydoun, but I know that they've done a significant number of inspections throughout the county.
One of the things I would like to mention too is perhaps you should probably look closely at, there should be a uniformity in the process. In other words, when the inspector comes out the first time and they give the business owner a list of items that need to be corrected, and then they come back and all the items have been checked and corrected, and they come up with a new list. And it happened 2 or 3 times. I was just a little bit concerned, why not just like have one list from the beginning? Some business owners were frustrated why they keep asking for new items every time they came out to re-inspect. That's the only thing I would ask you to look at, please, with your staff.
Okay, I will certainly review the procedure. I have to admit, I'm not as closely aligned with that, and I'm not an expert in that at all. However, I will look at and talk to my staff and see, can we address some of these challenges that you are bringing forth? And I will work with Dr. Seff and her staff in making sure we can address those.
Again, thank you for everything. There's one person I really like to mention. I know she's no longer in your department, Jennifer Floyd. She was amazing during the pandemic, and I just want to thank her publicly. She was a great person. Thank you.
Thank you very much.
Still is. I don't know if she left, but
No,
she's
she's
still
still
a great
here.
person.
Yes,
Yeah,
yes.
I talked to her.
She's
a
still
few-
with you?
She's still here, but she will be resigning in the next week or so.
Okay,
Yes,
well, good luck to Jennifer. She's a great person.
yes.
I just talked to her a few days ago and she's wonderful.
you.
Thank you very much. I want to mention that the public that I deal with has been asking for mold inspections. And as I understand, Wayne County does not do that. Am I wrong?
Commissioner Varga, I will have to get back to you on that. I am not familiar with we do mold inspection or not.
Only, I would like to have you think about maybe instituting something on that front if people really need to have it inspected, especially rental properties. Some of the landlords allow the water to be dripping and dripping and dripping and create mold before they fix the property. And it would be nice to be able to have a local institution to go out there and check it for.
I will look into that. And again, I'm not quite sure if that would fall under the health department, however. Mold is something that, of course, can have a public health impact, but
Right.
not necessarily be an area of expertise that public health has in determining what the repair needs to be or what one should do. So I think that's probably something I'll have to explore in terms of what other agencies handle, quote, housing issues and those landlord type issues.
I was actually thinking about maybe black mold, something that is hazardous to the health that could be identified. I don't want anything else done except the identification to be able to be done by the health department. If it's not a health issue, then it's not your issue. So that's where I'm coming from on that. The food trucks that are popping up everywhere in my district, I just absolutely love. I get the best food at those food trucks. How do we handle those? That question has been posed to me as well.
In terms of inspection, is that what you're saying?
Yes.
Again, I'll follow up with my inspection team to find out how they inspect trucks, or if that's part of their repertoire. I don't know. I'll have to find out for you.
Got my answer.
Very good.
The fees that you are currently charging, is that adequate? I know that a few years ago, quite a few years ago, we had to go and raise it quite a bit. And it would be good to do it instrumentally. And so I'm asking you, is it about time to research and see if we need to look at the fee structure again?
I will certainly work closely with my finance director, who's sitting here next to me, to review that in terms of if there needs to be an increase in terms of fees.
It would be good to do it little at a time as opposed to,
All
the
at
last
once.
one was very, very big.
Okay.
And the other request that I have, your presentation was so well done that we would love to have it electronically to all of our members.
Absolutely, be happy to
If you
provide it
would
to you.
please do that. Thank you very much. I can tell that you're very passionate about your job. And whenever that happens, it's a pleasure to listen to you. So we would do it longer, but we do have another presentation this morning. So thank you very much.
Thank you very much for having me. It's always a pleasure to work with each and every one of you.
Before I let you go, I want to make sure that Mr. Mark Abbo does need to cover a few things with you.
No, I just wanted to say thank you to Ms. Jordan for working with our staff and well, thank you to you and your staff for working with us. And thank you for your thoughtful presentation and responses to our questions.
Thank you. Thank you, Janelle. While we're waiting, I just have to say that I am so impressed with all of our departments so far, and I'm sure we will be for the rest of how they replied to our budget questions, our staff's questions. To all of us, it really is great to work at Wayne County. So I hope that more people will apply online and join us. It really is a pleasure. Mr. Mark Abbo?
Yes, thank you, Madam Chair. Last department reporting before our lunch break is economic development.
Morning.
Good morning, Commissioner Varga and Commissioners. Today are our three divisions for Economic Development Department, Economic Development, Community Development, and Buildings reporting. Yeah, we're really excited to bring forward a new budget. A lot of important initiatives are coming out of all three of our divisions, ranging from administration of community-based ARPA projects, emergency rental assistance programs. Our normal economic development initiatives include business attraction and retention, our small business support programs, and other initiatives within our community development buildings department that I'll let Tuesday and Daryl get into.
I'd like to acknowledge that we are joined by the Economic Development Committee Chair,
Hi, Tuesday Redmond, Community Development Director. We have CDBG, home, and ESG funds that we receive from the federal government. We also have COVID funding we receive, as well as ARP funding under the home program that we receive from HUD for COVID. We currently have our RFP out our CDBG program. And our ESG program is being ran by Samaritas. And we also do down payment assistance with our home program, and we'll be RFPing out the home funds as well.
That would help with it. Good morning, everyone. Commissioners, I'm glad to be here this morning. My name is Daryl Jones, Director of Economic Capital Development Department, which is also / Buildings Division. Here today necessarily to answer questions and let you know what the department consists of 28 buildings that we operate. And we maintain those buildings from the interior and exterior of the building. The buildings are in some dire needs. When I started 3 years ago, almost 3 years ago, October the 29th will be my 3rd year being here. And it's a pleasure to be here. We operate, we're a chargeback department. It's a chargeback department that is based on several municipalities that we deal with, making sure that structure is taken care of very, very well in the building. As we know, during the pandemic, we also supplied the sneeze guards and different process from that. Here today, basically, to give you information that you need and carry forth. If you have any questions for me, please feel free to ask.
As you all know, the COVID pandemic has caused a strain for resources in all of our departments and divisions. The Economic Development Department and our accompanying divisions expanded our roles and our responsibilities to support the needs of small businesses, to expand our outlook into workforce development programs, as well as other opportunities to support the residents of Wayne County, rental assistance, flood assistance, et cetera. We are looking to continue developing key programming to recruit the staff needed to implement the ARPA funding that we're working to implement across the county, and continue to develop initiatives that will lead to long-term prosperity for the county.
Thank you, Madam Chair. Thank you, Luz, for the presentation. Couple questions. First question, when is the deadline to use all the ARPA funding? Is it in 2024? Am I correct?
There's a deadline in 2024 that pertains to committing the funds. So there is an obligation deadline that comes in 2024 to make sure that all over the county funds have been allocated to a specific purpose. The spend deadline is 2025.
2025. In terms of all the ARPA projects in the different communities throughout Wayne County, when can we expect those projects to come in front of us so we can consider voting on them?
Yeah, I believe we've had one-on-one conversations with a number of commissioners over the last few weeks, including Commissioner Varga, Commissioner Jesus, and a number of others regarding projects that are coming forward. We have 12 community-based projects that are currently in process of being submitted via TCM for consideration as a set by the county commission. It's been a long process scoping out the projects. As you all know, we want to bring you all the highest level of detail, quality, and budgets, make sure that we're covering our bases, that any budget overruns on any of these projects are covered beyond the funds that are being committed by Wayne County. And then sitting down with the communities to go over contract, collect all of that documentation. So we have 12 projects that we feel very confident about, that are in a good stage of development of scope, with professional pricing and all of the elements that you all will be looking for as part of those projects. And we have a couple dozen of other projects that are coming along in a really good place. We're working closely with our communities. As you know, not all of them have the resources to put together a detailed scope in advance of a proposal for these projects. Moving dozens of projects is a large task. We have an amazing team that's working on it. I know our business development managers and project managers have been in contact with you all and with your municipalities. So it's a long road, but we're certainly working on bringing those forward. And you should probably be seeing those within the next month, the 12 set of projects.
Again, the final question, as you know, there are restrictions on these funds from the ARPA funds. Just for the benefits of the people who might be listening to us on Zoom, what could this money be used for? Projects that are going to benefit the public. It cannot be used, for example, to cities on salaries to pay their staff. Am I correct?
Right. There are many restrictions to the ARPA funds. Obviously, we're not looking to supplement general funds within our individual municipalities, within the priorities set by the county executive and shared with you all very early on during this process. You all know that we have 6 key areas that we're looking to invest in, that include public spaces, economic development, infrastructure, health. I'm missing 2 more. Public spaces, economic development, workforce development, infrastructure, public health. And there's one more there that'll come to me eventually. And these are, at least for our department and in conjunction with some of our sister departments, public spaces is a big one, economic development is a big one, workforce development and small business support are really big key anchors of that. With our municipalities, a lot of what we're seeing are proposals to improve parks and create recreational opportunities for residents that are both an economic boost and also a boost to the public public health and public well-being. We're also seeing investments in commercial corridors that we're working with the state to potentially secure a grant and maximize the funds that we're investing in our commercial corridors to revitalize our small business community. So those are some of the key areas that we're seeing.
Thank you, Luz. I'm very excited for what's coming to my district, especially in the city of Dearborn, in terms of the partnership with Wayne County. Thank you again.
Absolutely.
You, Commissioner Maraki?
Thank you, Madam Chair, and actually Commissioner Baydoun probably asked the questions that all of us were going to ask, so it's good it started out like that. Of course, we are all thrilled for Khalil for his new adventure, but like so sad that he's leaving, all the good work he's done. But my question is, and you're saying this has been a long road with this ARPA fund, and I get it, especially with doing the IGAs and all that type of thing. And there's been some loss with WAFA leaving and everything. How much with Khalil leaving, is this process going to even get slower, or it's going to keep moving along?
I'm really confident in the work of our department and our divisions. I think, you know, Khalil leaves an amazing legacy. Part of that legacy is having really a strong eye for talent. And you can see that across all of our divisions and many departments across the county. Our team has been carrying the work. And of course, I think we all know Khalil as the king of negotiation and of, you know, coming together with our municipalities for a common goal. I think there's a lot of progress there. We're in a really good place with our municipalities. And as you know, we have some difficult conversations still that we're working through, but I'm confident, and I'm gonna ask, we have members of the Economic and Community Development team. I'm going to ask them to stand briefly because we have an amazing team. You all have given us the opportunity to continue to add to this team and to add to the work that we're doing, both in the economic development space when it comes to development of green lands, brownfields, small business support, workforce development, but also in our engagement with our municipalities to provide resources as we grow out of this pandemic.
Okay, thank you. I appreciate that. And he does have a real talent finding people that are excellent. And that's why he's moving on to this next job, which he's going to really be able to use his talent. Okay, I think that's really all. I mean, your report in the CEO's big report of the county was very good. And, oh, I have one question. There's a huge drop in the federal grants in 2024. Is that, are you aware? Okay. And why is that? I mean, that's a big drop. That has nothing to do with any ARPA money, right?
No, some of the drop is we've expended some of the funding. So that number would go down. Then also the funding that we receive, HUD allocates what we receive. So I know for CDBG, it might've been a drop of like 55,000 or something like that, where home went from 2,000,008 to 3,122,427. So we get that number we get a letter from HUD and they identify what funds, the amount of funds that we receive.
Okay, this is the chart of all the funds. So it's dropping almost $22 million by 2024. So you're saying that there's several funds that
With some of the funds that we actually have are COVID funds.
Okay.
So we don't get COVID funds every year. So we've expended some of those COVID funds. So that amount that we would have for the next year would drop down because we've expended a lot of those.
Okay. I was wondering, and I just didn't mean to say ARPA. I meant COVID too
I
as
understand.
well. Okay, so that's part of the explanation for that. All right, thank you. Thanks, Madam Chair.
Commissioner Kinlock?
Yes. Absolutely. I want to say that it was an extreme honor to work with Khalil over at the Economic Development Corporation Board. He has been an amazing administrator and cheerleader for the county and have put together an incredible staff who I happen to say they're very responsive and take their job very serious. And I'm quite sure that they're able to carry on doing the work that they've been doing, since they've been here. So I'm confident that these ARPA programs and recommendations will come through, in an efficient fashion. One thing I wanted to ask was, we had an announcement up in Mackinac where there was to be an ARPA project or appropriation that was going to come before the commission that would help small businesses to be able to hire professional advisors and other experts to help them grow their business. And just was wondering what was the status as it relates to that. And when looking at the budget, where is the money? I know that we received it, a portion of it. I'm not sure exactly how much we've received from the federal government, but where is that money actually parked at before it's spent?
Yeah, that's a really good question for our folks with M&B. It's certainly not a part of my budget, but I think folks from M&B might be on the line to share that information.
But and while we wait on that response, the announcement that we made in Mackinac, the status of that.
Absolutely. Yes, those are coming. We have, run into some hiccups in the bringing forth of the contract. We do expect to have a contract to you all in the coming month or so. We're making sure that we're checking all of our bases and providing all of the adequate information from a contracting perspective to make sure that this program operates efficiently, that it's well funded, that it's well resourced, and that it has the opportunity to sustain itself beyond the life of our ARPA dollars.
Okay, one of the buckets, green spaces. How do you define green spaces as far as projects that can be considered that would align with being able to receive ARPA dollars? What are green spaces? And specifically, I'm asking, are there any online to come before us from the city of Detroit? These, as you are aware, are not as restricted as block grant dollars. So just wondering, how green space would be defined, or what sort of projects would be defined as.
Just to clarify, you're asking about CDBG funds, not ARPA?
No, ARPA, the green space bucket,
Yeah, the public spaces sector.
Yeah, public spaces,
Yeah,
I'm sorry.
we do have a number
Green
of projects that you all are familiar with within the public spaces. Commissioner Baidoon mentioned an investment we're making in a parks strategy in the city of Dearborn. We are intending and bringing forth a proposal for the Joe Louis Greenway and a significant investment to match up with the funds that the state of Michigan has put forth for the construction of the Greenway, particularly supporting some of the portions of the Greenway that intersect with other Wayne County communities, Highland Park, Hamtramck, city of Dearborn. So we do expect to see that. In terms of public spaces, there's also a proposal for the Motown Museum, which I know a lot of the members of our commission as well as of the administration are passionate about supporting. There is a Riverwalk project in the city of Northville. There's a park project in the city of Taylor. So there are a number of mostly parks that are coming forward. As I mentioned, in terms of our commercial corridors, we are waiting an answer from the state for their revitalization and placemaking grant so that we can match those funds with our ARPA funds and stretch our dollar for commercial revitalization projects, public spaces along our commercial corridors.
Thank you. And then the other question we were waiting on, Management and budget.
Development?
The MNB question.
Good
Budget
morning.
Director is here.
Yeah, thank you, Chairwoman. I'm Drew Vandegrift, Wayne County Budget Director. Commissioner Kenlock, that's a great question. I'm glad to answer it. So the ARPA program is divided largely between two funds. We have 299 and 291. The small business program is focused on Fund 299. And you may recall that the county's approach to budgeting ARPA initiatives is specific to the project. So we have a budget adjustment for this small business program that you will see in conjunction with the associated contract for the ultimate activity. And then as the year changes from fiscal 22 to fiscal 23, we'll see what is left to be expended. There will be a decertification and a recertification to straddle the fiscal years.
Thank you.
Thank you. Do you have any more questions? Commissioner Baker McCormick is next.
Chair. So as we talk about the expense or expending of the ARPA funds, I wanted to see if we had a breakdown in the communities in which the funds are being divvied up. And I think I asked for that in another meeting, but do you have that information broken down by zip code or communities?
We have, so our intention is to fund one project in each of our 43 communities. It's a lofty goal, but our business development managers are working diligently with those communities to bring forth projects. I think we have project submissions from most of the communities. We're happy to share the count. There are a lot of areas where the requests from the communities didn't really match up with the priorities. And we're going back to them to see if there's a project within their portfolio that might better fit there. Are you asking for a count of submissions for projects by community?
Yes.
Yeah, we can provide that.
Do you know, did you receive anything from Redford Township yet?
Yes, I believe we have a project in scoping for Redford, and I can pull it up in just a second.
Well, we could talk about it offline. I was just wondering.
Yes, we have an active project that we're scoping out with the city of Redford. I believe they were part of our RAP grant application as well.
And we also, the areas, the 5 areas of concentration, I think it was 5 that you mentioned, public spaces, health, economic development, workforce, and I don't know what.
Structure. There's like one more that I can't bring to my mind.
Okay. So the question is for homeowners, home improvement, we talked about some programs for that because most of us, or at least I know I live in a district where there's older homes, and a lot of our folks are really pressured to stay in their homes first and then also update major improvements like, a roof or things of that nature. So are we looking at any type of grants for home improvement, not just for seniors, but overall?
Yeah, we're evaluating and strategizing. I think there are a number of items that overlap with that I'm sure you'll be keen to. The first one being that a lot of our municipalities have municipal level programs that we don't intend to duplicate if they're already running and working. I know the city of Detroit is a big one for their zero interest loans and things like that. In addition to, we also know there's funding from state and federal government that is is restricted to these initiatives, right, that we want to maximize. So if there's a restricted source of funding for home improvement, both, thinking from our municipal level, but also additional opportunities that are available with the government, we want to look at those first and spend those dollars first. But we are certainly, as part of the strategic focus of our programs, looking into projects that delve into the housing sector as well. Yeah.
Yes, because, as we expend these funds, for me, it's vitally important that we look at how it's going to impact our residents long-term and to maximize the use of the funds. So definitely, we don't want to provide additional funds for services that are already being provided by a municipality. So I definitely agree with you on that. Airtropolis projects. Do we have, and I didn't really see a breakout of what projects or what we're working on and that.
And thank you, because you took me to the sixth point that I was missing, which is housing. The Aerotropolis operates as a separate entity. We work really closely. Our business development managers are, engaged closely with our Aerotropolis partners. There are a number of projects that have come out of Aerotropolis. Really, I think the number of development of square feet currently is in the millions. Of projects that are developing in this region. We're also, as you know, have been in conversations with the state to secure funding to increase access to some of the properties along the Willow Run Airport area. And so we're looking to create expanded capacity for greenfields around Willow Run particularly, but with our Aerotropolis really targeting additional development in that space. That is, however, a separate entity.
And we're not using any ARPA funds or anything?
Not at this time, no.
Okay. And my last question goes to Mr. Jones. You talked about properties, 28 properties that you service, I guess, or manage. Is there a way, and I don't see a list of the properties, that we can get a list of those?
Yes, I can provide you.
Okay. And you talked about some major improvements that was needed for, is that all of the properties or major improvements on several of the projects that you're working on? Or
Well, there's a multitude of properties. As I stated 3 years ago, as we did an evaluation, we're proud to probably announce that we have a property analysis sheet that we work together in giving those capital development process properties that we need to repair and major repairs that are existing with those properties. There's the lack of maintenance of the properties over the years has called for deterioration of certain buildings. And what we do is evaluate each building and give you a budget cost of what it costs to make those initial repairs, or even sometimes go out to seek other buildings that may be compatible that we can actually move and save the county money in order to move into those areas. So I can't provide you with that list. And the 28 properties is a surrounding of where we co-chair with DPS somewhat, is that we may handle some of the mechanical issues as far as skilled trades, and some of the parts of process that DPS will handle as well.
And of these properties, all of them are occupied with some sort of county services, or, okay. So we wouldn't, are we looking at selling any of the properties?
Not at this time. We're doing some evaluations. Of course, we need to be able to find, in order to relocate and view some other properties. We are in the process of looking maybe to evaluate a few buildings and not put as much money into those buildings. And I think you're aware of the CJC, so that is going to take away about 4 buildings. We always indicate that it's 4, but it's actually 5 because we have a facility maintenance building that will be on site as well.
Thank you. Thank you.
AMAC building, I know that we occupy part of it. Do you have any specific area to bring more people in or move the clerk down? To kind of expound on that one.
Yes, Commissioner Varga. Yes, I think we operate a third of the KMAC building. We are looking at plans to, well, we always make improvements in that area. One of the things is that the clerk is no secret that they are kind of in tight quarters. So we are visualizing a plan to potentially move them to a different location. And in particular, we're talking about 400 Monroe. And that's just necessarily to be able to allow them to be able to function more in a business type area and to make sure that the improvements in that area be taken for them to move at that point. Now, there will be no changes as far as the occupied space that the county has at KMAC. That will still exist. They're just expanding their business.
That I understand, but we're paying for the space. So are we putting another department? How are we going to make that revenue neutral?
I have that answer for you right now. And then basically, I think I will probably communicate with the clerk office to give you a definite answer on that. It was going to be some remodelization that was going to be done at the KMAC building, and after reviewing it, this was a process that we've been working on for the last year, and economically it makes more sense to acquire more space at 400 Monroe in order to make that happen.
And when would this take place?
We're trying to get that done as soon as possible. We've been in I would say some heated discussions with a lot of end users at the 400 Monroe, trying to make sure that we get them on board. And it's a process, and actually there's funding that the tenant itself, that the proprietor necessarily provides in our agreement. And that's one of the things that we're using. So we do not use a lot of our own dollars in order to make that happen.
Clerk will be coming forward yet, so just want to be prepared for that one. I also have on the list Commissioner Anderson.
Thank you. Along those questions, Madam Chair, I had a question about the occupancy rate, or what is our occupancy in the KMAC and the Guardian building and any other buildings that the county currently occupies. Occupancy rate. I guess what I'm leading to is I'm just concerned that we're going to be moving people into another place that we're going to be paying additional rent, more leases, utilizing the buildings that we own. That's a concern.
I understand, Commissioner Anderson, what you're saying. As I indicated, most of the time it's evaluation as far as the occupancy and how many staff employees that is going to be at that area. It was no secret that at KMAC, the clerk office was full to capacity even before the pandemic. And with the pandemic necessarily taking place, there was a lot of their staff that may have been off or potential new hires. So with the two potential new hires that will be coming aboard by the first of the year, October fiscal, that there will be a lot of positions that probably be filled by the clerk. I don't know what the number that is because that's an internal department by the clerk office. But as far as the numbers, what we have is only what we've been told. So we usually look at our analysis sheet and say in comparison, because it's a building space capacity. And you're totally right on that, is that we look at that and that end user may tell us how many spots that they need, and we do a walk evaluation and say, well, if this is what you need, they submit that. Normally has been submitted to a higher person than me, and then basically I go through the numbers and make sure that it's probably acceptable, or come up with a plan and say, well, this is what you need as far as space.
So utilization of the spaces that we own and those that we lease, do you have a report on that where the commission could see that?
I can probably get one to you. I don't have one right now, to be honest.
If you could, I think that would give us a better perspective on and answer some questions.
Good morning, Commissioner Anderson. My name is Ani Mendoza. I act as the Executive Director for the Economic Development Corporation, which helps manage the Guardian Building. We do have occupancy statistics. As of July, we were at a 92% occupancy. We work closely with Beanstalk, hand in hand to make sure that the properties that can be leased out are leased out. We are actively marketing it. We do walkthroughs almost every day. I'm sure you guys are all familiar with Shannon Hag. She makes our job easy, which we're really grateful for. But we are actively marketing all the properties that we have vacant. We have 35,000 square feet that are vacant in the Guardian Building. I can cover First Street Garage as well. On Tuesdays through Thursdays, we have about 500 cars come in through the parking garage. And on Mondays and Fridays, about 250 to 300 that are occupying the First Street parking garage. And I think that is really based off of the flexible work schedules that our occupants are having with their employees. And I'm happy to provide, I think I spoke to somebody on the auditing side about providing quarterly reports upon request to the commission, and would be happy to do so.
I appreciate it. One of the part of this building that was originally going to be leased out to a restaurant, the bottom floor, I guess it, and what is happening with that? Because apparently there must not have been an agreement or a contract that said they had to restore it if they decided not to go forward with it, but it looks like they abandoned the project.
Yep. So that's a great question. That's a really valuable space that can bring in a lot of foot traffic, especially for the Guardian Building as a whole. So we did have a few furniture suppliers offered to remodel that area in exchange for allowing them temporarily to lease it for free. It would be them revamping it. We have not entered into any formal contract, but that has been one of those creative spaces that we're leaning on our partners over at Beanstalk to kind of come up with creative spaces, creative ways to bring foot traffic into that area. So you're correct, there was supposed to be a restaurant. I don't have the answer on any repercussions to that contract. If we need to take any legal action for them not fulfilling that, to my knowledge, there is no course to take beyond trying to find a new occupant in that area. And so we have been working with Beanstalk to market it. If you guys are familiar with First Street Parking Garage, the bottom area of that parking garage is a vacant space. I believe UPS had been using it for some time. We do have a potential tenant that we're talking to now to be able to use that space and bring in an income on that side for the parking garage. So I rest assured I'd be happy to provide our monthly reports that we do have. But for the vacant and available properties, we are looking to actively lease those monthly. I can tell you that we have, let me see, we have 16 events that are booked through September of 2023. We are trying to find creative ways to bring in income to the Guardian Building so that we can push that back into our operations.
Talking about the 30th floor?
Yeah, and the Promenade. We're finding creative spaces, but it's primarily the 32nd floor as well. We're looking to get the candlelight series, trying to into the Guardian Building. So just trying to be creative about getting folks into the Guardian Building, especially with foot traffic, and to support our small businesses on the first floor.
If you could provide us a brief report on what happened downstairs.
Yes.
And if our corp counsel has looked at it to see whether or not there's any recovery for that facility in favor to fulfill the contract.
Yes, I'd be happy to provide a narrative on that.
On another matter, the ARPA dollars, we had.
Excuse me. I think Felicia has an answer for you on the last question.
Okay.
I do not have an answer, but I have a to that point, this along the lines of where you were going, if that's okay.
Yes.
Chairwoman. So just for clarification, you indicated that you manage properties. Can you just specify, and you said vacant, you mentioned vacancies in those properties. Are you referring to, what buildings exactly are you referring to that the EDC manages on behalf of the county?
It would be First Street Parking Garage in the Guardian Building. When I speak to vacancies, I mean vacancies on the floors and the spaces.
I just wanted to clarify because it sounded as if you were referring to other properties. So I wanted to clarify that. And then for purposes of the commissions, Commissioner, when you mentioned the contract and if there's repercussions, I raised the same issue I've been raising since the county entered into the agreement to allow the EDC to manage the building, which was literally 2 sentences in a bond document. And whether or not those contracts, what authority they have to actually enter into contracts on behalf of the county without those contracts coming here, because this body has not relinquished any of its contract authority. More importantly, we just talked about bringing income into the Guardian building. What authority do they have to expend those funds without those funds ever hitting this commission? Because the law says that this body and no funds can be spent unless they are appropriated. This body has never appropriated funds for the Guardian building because the administration has set up a process by which they've separated that funding out to the EDC. But again, I ask for every year, what is the legal authority for those funds not to come through the county budget, and how can they properly be expended if they never, the commission never sees them? And again, this is a county building. We've talked about this over the years. People had questions in the past whether the county owned it. The county owns this building. And if there are proceeds coming from a county-owned property, how do those proceeds never come through the county budget process and through this body?
Thank you for that.
Thank you.
I will have to get back with my corporation counsel, and I'm sure they have a bit more institutional knowledge than I do to be able to answer that appropriately.
Thank you. You may
Madam-
continue,
Okay,
Commissioner
thank you.
Anderson. Sorry about that.
Oh, no, very good point. And I know our council has brought that to our attention for some time. And there's been basically a standoff between the administration and the commission. I'd propose that we find a way to break that stalemate, and whether it be some way taking it to a court to find out, the interpretation of it, something to resolve the issue, because it is I think, wrong that we are allowing money to be spent without being appropriated by this commission. It should go through the process as everything else, contracts as well. But not to belabor that any further, but I did want to ask that, I know Commissioner McCormick mentioned about information from the different communities, and I had asked for that previously. I received a partial list, and with some information, there was supposed to be some more information coming forth that would spell out which city in that report. So we would have that. I haven't seen that. I don't know where that's at. If it missed my attention or I missed it, but I haven't seen that.
Chairwoman, may I respond?
Yes.
Through Vandy Grift, Wayne County Budget Director, Commissioner Anderson, your request has not been forgotten. I forwarded that request for the demographic and regional allocations of those ARPA projects to Guidehouse, and I received a confirmation that they are working on that last Friday. So I would hope that that would be available for your consumption soon.
I believe I've also spoken to your staff, and, we're always happy to meet and go over your questions and answer them, in person to make sure that all of your questions are resolved.
I do prefer things in writing, to be honest, so I can, there's, it is easy to have a misunderstanding about what was discussed when you don't have it in writing. So that's the only reason. But, I would like to see, the number of projects that you've received, the county's received, who they've come from, what the projects are, the status of those, as well as what if there's something that's holding it up and it's on the end of the community, then we'd like to know what that is. I think every one of us would like to, be able to talk to our community and say, this is what's holding your project up. And be a partner in that to try to get those things that you need, because we don't want to see our communities that have a project that has been submitted properly, maybe some I's not dotted and T's not crossed. I mean, simplifying it, but just things that may be holding the project up from approval, and the status of every project where it's at. Number two I have was, and I think it's the last thing I have, like to see the qualifying criteria that's used on these projects. Specifically, what type of projects only, not only that, but also what the county is looking for as far as the shared cost, what the community puts into it, and what's going to be applied across the board to every project.
There's a presentation we'd given that you all might have, but we'll resend again with, again, the 6 priority areas that were established for this area of work, as well as some of the guidelines related to the Arpa legislation and other considerations that include things like equity, feasibility, et cetera. We'll resend that out for you all to.
Does that include do you have a point system or whatever, meeting certain criteria, or is everyone
We're
treated?
working with all communities equally, right? The idea is that they identify their set of projects that they'd like for us to consider. You all are probably understanding of the fact that, we got, I think it was the amount of money that was requested, or the project cost is in the billions. We don't have that amount of money. So we're really prioritizing, checking in with each of the individual communities and identifying from their end of things, what is their priority, matching that up with the priority set by the county, looking at how much leverage they have put into the project, right? We're not just looking to fund a dream project that they had no intention of funding otherwise, but we're hoping to supplement some of their intended plans and fill some gaps in funding. So we are looking for them generally to come halfway with funding, especially for some of those large projects. In some instances with really small projects and communities that don't have the capability, we can work out different options, and particularly we've been supporting them in applying for additional sources of funding. That has been the case for Redford, where we're considering both a rec center and a commercial corridor initiative, and supporting them through applications for federal and state funds. So we're looking at a number of options to supplement all of those projects and to make sure that we have funding commitments from them, to make sure they have some skin in the game from the projects that we're supporting with any additional funds available, that the program is feasible and will be completed by the expiration of the ARPA funds, and among a number of other things. And we are happy to provide that information to you all.
Please do. Thank you. Thank you, Madam Chair.
So, if I could, ask Larry Abel to chime in.
Thank you, Madam Chair. I just have a comment, and it goes to the deadline associated also with the ARPA funds, but let me get to that. Last week when we were talking about ARPA, it had been indicated that we'd spent $2.8 million, that we had obligated $88.4 million, and that we have proposals for $145 million. So that comes to about 236 of the $339 million available. So we roughly have just over $100 million left to go. I remember when ARPA was first discussed with Halal, and I remember the term that he used. He said he wanted the use of this money to be transformational. Transformational. To me, that means future tax revenue, economic activity, jobs growth. To me, that's transformational, because it'll be continued growth of Wayne County. I know that we had committed a lot of money to workforce development, $50 million just last week. And I think that that's laudable, but I think that it's really important too that we create transformation. Anyway, transformational, so that there are jobs available when our workforce is developed. I think that we have to do that. So my question is, do you think that are we achieving that objective of transformational? And two, we keep on talking about this deadline for ARPA. One of the uses for ARPA is lost revenue. It is my understanding that when you apply the formulas of lost revenue, that of the $339 million, we can make an assertion that as much as 160 million of it is lost revenue. $160 million can effectively go into our general fund as lost revenue, and we could assign it and use it without the deadline associated with December of 2024. Is that a consideration so that we don't push it and that we have the opportunity to do what's been alleged and that becomes transformational projects?
I can answer the first portion of your question, and then I think the second portion will go to the bigger brains over here in terms of how we utilize that within the different categories of ARPA. But I will say absolutely the projects that we are investing in will generate long-term tax revenue for us and for our municipalities. We're looking not just to obviously invest in things like.
Well, let me just say, I'm not just talking about tax revenue. I'm talking about economic activity and jobs.
Absolutely,
growth.
absolutely. I mean, one of the major initiatives are commercial corridor revitalization program. We're talking about reviving storefronts, creating pedestrian activity. We learned during the pandemic that people, especially our younger generations, want opportunities to be outside in public spaces, to live in places where they have access to amenities like parks, trails, business districts, et cetera. We want to improve quality of life and health. So all of these things, ultimately, we think about attracting population, right? That has been probably one of the major goals for the county over the recent history. And it is a goal through our revitalization efforts. You can see the impact that placemaking is having in the city of Detroit, where we are seeing neighborhoods that were long, dwindling populations now growing due to programs like the Livernois redevelopment and other similar projects. So we do think these investments in quality of life for our existing residents, making sure that they have a place that's sustainable and that will provide them the resources they need on a day-to-day, but also attracting tourism and attracting other residents to repopulate Wayne County and to create that economic vitality that we all hope for. I agree with you. This is a transformational one-time investment, and we're working with our communities to make sure that we both see that in terms of the priorities that they've set forth.
And Woman, may I supplement that answer?
Yes, go ahead.
Thank you.
And then I have an announcement.
Very good. Drew Vandergrift, Wayne County Budget Director. Mark, I have nothing but positive regard for that suggestion. There's a number of uses for ARPA dollars, right? And so if I follow your comment, why not convert ARPA dollars into a less restrictive form? And my only comment on that, Mark, is that we still have a lot of time between now and 2026, and that there are some legacy restrictions on revenue use dollars, such as an inability to use them for pension, other things. But no, I think that that's a smart strategy that should be considered in the portfolio of uses for ARPA dollars.
Again, Drew, my comment is rather than forcing it, we do have more time if we take that avenue.
Mm-hmm.
Thank you.
Thank you. Because we have so many questions still or so many inquiries, I would like to request that perhaps you could join us for lunch, and we take a 15-minute recess and all of us get a plate and work through lunch. Right after we get our plates, we could eat at the desk because we do have a lot to cover yet today. So I would like to know from you, can you stay with us for half hour, about 15 minutes after we come back from recess? Okay, thank you. The committee will